Tes 1 2 3 tes. Tes, halo. Tes 1 2 3. Tes 1 2 3. Tes, halo. Halo, tes 1 2 3. Tes. sekalian, untuk Pak Awis, apakah sudah join?
Oke, sudah.
Baik, terima kasih. Before we get started, I would like to go over some important rules for attendees. The first, you should mute your microphone to keep bigger noise to a minimum level. Make sure you mute your microphone when you're not speaking. Second, be mindful of background noise when your microphone is not muted. Avoid activities that could create additional noise, such as sharpening papers. Third, please turn on your camera and position your camera properly. If you choose to use web camera, make sure it's in stable position and focus, so it can help to create a more direct sense of engagement with other participants. The next one, limit distraction. You can make it easier to focus on meeting by turning notification, pausing or minimizing running apps, and muting your microphone. Next, avoid multitasking. You will retain the discussion better if you refrain replying to emails or text message during the meeting, and wait to work on the PowerPoint presentation until the meetings. And last, prepare material in advance. If you are going to share content during the meeting, make sure you have the file and or links ready to go before the meeting begins. Now, I'm going to start the event. Excellencies, distinguished guest participants, ladies and gentlemen, Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
The Honorable Mr. Dr. Awis Hamidani, ST MMPD MKM, as Head of Stikes Cirebon. The Honorable Mr. Yusron Adi Utomo, ST Erad MKM, as Head of Radio Diagnostic and Radiotherapy Third Diploma and Speaker. The Honorable Ms. Supihapu Lakbundrum, as Speaker, and my beloved participant in today's event. Peace be upon you. A very good morning to you all. Welcome to the International Public Lecture of Radio Diagnostic and Radiotherapy Third Diploma Student Association. Stikes Cirebon with the theme Head Vascular Imaging and Pediatric Imaging. Stikes Cirebon is delighted to welcome all participants from all around the globe. My name is Lu Sepiani and I'm excited to be your host for this event. For start of our opening ceremony, we will sing the national song of the Republic of Indonesia, Indonesia Raya, and Mars Stikes Cirebon.
Indonesia, tanah airku, tanah tumpah darahku. Di sanalah aku berdiri, jadi pandu ibuku.
Indonesia, kebangsaanku, bangsa dan tanah airku. Marilah kita
Now we move on to the speech segment that is going to be started with an opening speech. Please to Farhan Fadila, a chair of the International Public Lecture Event Committee. Time and place are yours.
Thank you to the Master of Ceremony giving me time. Assalamualaikum warahmatullahi wabarakatuh. Firstly, please introduce my name is Farhan Fadila. It is a great honor to welcome you to this prestigious event, a public lecture on head vascular imaging and pediatric imaging. We are gathered here today to gain insights from two outstanding speakers who have made great contribution to the world of radiology. Our first speaker, Mrs. Supiha Fulabunrung, as clinical specialist outbreak intervention from Thailand, will discuss the fascinating topic of head vascular imaging. Mrs. Supiha's expertise in this field is well known, and we are eager to learn from her research and insights on how head vascular itself. Our second speaker, Mr. Yusron Adi Tomo from Indonesia, will provide us with knowledge on pediatric imaging. Mr. Yusron's extensive knowledge of pediatric imaging is invaluable, especially in today's world of radiology. His insights promise to explain the ever-evolving pediatric imaging in the face of difficulties in the world of radiology. I would like to thank Mrs. Supiha Fulabunrung and Mr. Yusron Adiutomo for sharing their expertise with us today. Your contributions are very important in this world of radiology. Hopefully, this public lecture even can be beneficial for you students who attended this event and radiographers, hopefully gaining knowledge and keeping up with the latest trends and innovation in the world of radiology. That's all I can say. Thank you for attention. Assalamualaikum warahmatullahi wabarakatuh.
Thank you for your amazing speech, Farhan Fadila. Next speech from Mr. Yusron Adi Utomo, Aspirant MKM, as Head of Radiodiagnostic and Radiotherapeutic Diploma. Time and place are yours.
Okay, thank you for the time, Ms. Lulu Septiani. Before let us begin, are you hear my voice clearly?
Yes, we can hear your voice.
Okay. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Good morning and best wishes for all of us. The Honorable for Head of Stikes Cirebon, Mr. Dr. Awis Hamidani, and the Honorable for our guest speaker, Ms. Supiha Fulabunrung from Thailand, and all of Radiologic Technology Students, Society of Stikes Cirebon, and all of participants. First, let us give thanks to presence of Allah Subhanahu wa Ta'ala, the most gracious and merciful God, because with His permission, today we can gather here to jointly take a part in the international public lecture with the theme Head Vascular Imaging and Pediatric Imaging. I want to thank Head of Stikes Cirebon who have supported so that this event can be held successfully. All radiology students, with the rapid development of technology in the field of radiology, all college as radiology students need to motivate themselves and continuous and improve their competence and be able to quickly adapt to the development radiology technology. One of the most rapid development in radiology technology is the development for modalities that make it easier for radiographer in carrying out that is, for example, in radiology examination is head vascular imaging and pediatric imaging. Global competition is now a new challenge in the medical world, especially in the field of radiology. Therefore, the radiology program of Stikes Cirebon is always committed to improving and equipping students' competence to be able to compete amid global competition. One of which is taught in this event and public lecture activity. We hope the student can participate in this activity until the event is finished. We want to say, let's enjoy this event. I think it's enough. Thank you for your attention. Assalamualaikum warahmatullahi wabarakatuh.
Thank you for your wonderful speech, Mr. Isnan Adi Utama, STRAD MKM. And the last speech, please be invited Head of Stikes Cirebon, Mr. Dr. Awis Hamidani, STMMPD MKM, as well as opening today's event. Time and place are yours.
Okay, thank you, Lulu. Has my voice be heard, Lulu?
Yes, we can hear your voice, Mr.
Okay,
Dr. Awis.
thank you. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam
Waalaikumsalam warahmatullahi wabarakatuh.
Yeah, greetings to all of us. Good morning, ladies and gentlemen. First of all, let me express our gratitude and praises toward of the Almighty God, Allah Subhanahu wa Ta'ala. Because of all His grace and guidance, and this day we can gather in this place. Venerable Head of Radiology Study Program, Mr. Tomo, Venerable outstanding keynote speaker, Mrs. Sufisa Pulapunrung, and Venerable of the official of Stikes Cirebon, and all of the members of this international public lecture. Ladies and gentlemen, the main theme of this international public lecture heads vascular imaging and pediatric imaging. This international public lecture, even to be proud of, since it provides evidence of achievement of Stikes Cirebon in the academic arena, which will encourage of self-confidence in developing potential and hope. So, as to provide energy for the academic community to participate and to be active in developing knowledge in the field of the radiology and has experience in international level seminar. Ladies and gentlemen, this international public lecture was attended by the head of the radiology study program, student, and their participant was very meaningful for this activity. For this reason, I would like to express my highest thanks and appreciation to Mrs. Supricha Pulapunrung, head of the study program, and the radiology student association, and all parties who have provided their support in organizing international public lecture. Okay, the last I will open this event by saying Bismillahirrahmanirrahim. Thank you for your kind attention. See you later. This all from me. The last I say wassalamualaikum warahmatullahi wabarakatuh.
Okay, thank you for your mesmerizing speech, Mr. Dr. Awis Hamidani, STM and PDMKM. Next, we will listen to a prior recitation presented by Muhammad Iqbal Lutfi.
And gentlemen, please become and sit and try according to their respective place. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين حمدا شاكرين حمدا يكفي مزيدا يا ربنا لك الحمد كما ينبغي لجلالك الكريم بسلطانك اللهم صل على سيدنا محمد وعلى آل سيدنا محمد اللهم صل على سيدنا محمد الفاتح لما أغلق والخاتم لما سبق والناشر الحق بالحق والهدي إلى صراطك المستقيم وعلى آله وصحبه حق قدره ومقداره العظيم اللهم أحينا بالإيمان وأمتنا بالإيمان وأدخلنا الجنة بالإيمان اللهم بارك لنا في يومنا هذا اللهم بارك لنا في يومنا هذا اللهم بارك لنا في يومنا هذا اللهم إن نسألك سلامة في الدين وعافية في الجسد وزيادة في العلم وبركة في الرزق وتوبة قبل الموت ورحمة عند الموت ومغفرة بعد الموت اللهم أعطي علينا في شكر الموت والنجاة من النار والعفو عند الحساب ربنا لا تزغ قلوبنا بعد إذ هديتنا وهب لنا من لدنك رحمة إنك أنت الوهاب ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار وأدخلنا الجنة مع الأبرار يا عزيز يا غفار يا رب العالمين سبحان ربك رب العزة عما يصفون وسلام على المرسلين والحمد لله رب العالمين.
Now, before we start this event, we would like to have a first session together, led by Mr. Anik Alimuddin. So all participants, please turn on your camera. So all participants, please turn your camera. It's time to have a presentation. Okay, ready to first slide. 1, 2, 3. Okay. For the next slide, 1, 2, 3, smile. For the next slide, smile. Next slide. Okay. For the next slide. Okay, done. Thank you for all participants. Please pay attention for all participants to fill out the international public lecture attendance form that will be sent by the commit in the Zoom chat room. For the next discussion will be continued by Restu Dewi Fortuna as our moderator. Restu Dewi Fortuna, the time is yours.
All right, thank you very much to my friend Lulu as a master of ceremony on this event. Assalamualaikum warahmatullahi wabarakatuh. The Honorable Mr. Dr. Awis Hamid Dhani, STM, MPD, MKM, as a head of Stikes Cirebon. The Honorable Mr. Yusron Adi Utomo, STR, MKM, as a head of radiology in Stikes Cirebon and as a speaker. The Honorable Ms. Supiha Fular Punru as a speaker, and my beloved participants in today's event. Good morning, ladies and gentlemen. This is the International Public Lecture of Radiology on 2023. My name is Restu Dewi Fortuna, and I'm going to be the moderator today. So, because we're all as a radiologist and we always need a lot of material about radiology because the radiology is a science that always expanding in line with developments or over time and technology. For that, we have two speakers who already with us. The first one is Ms. Supiha Fularpunrung from Thailand, and the second one we have Mr. Yusron Adi Utomo as a head of radiology on Stikes Cirebon from Indonesia. And I would like to greet Ms. Supiha first. Hello, Miss Supiha, are you with us?
Yes, can you hear my voice?
Yes, I can hear you, Miss. Thank you. Okay, great. The next is Mr. Yusron. Hello, Mr. Yusron, are you with us?
Okay, hi,
Okay, great.
I'm
Thank you.
ready.
Okay, thank you. Right now, I'm going to do our presentation during 2 hours. All the speakers will talk around 45 minutes, and after the two speakers have presented their topics, we will have a discussion for about 15 minutes. And all audience can ask the question. If you have any question, you can ask to the speakers after the speaker finish their presentation. You can raising your hand and typing your question in the room chat in the Zoom, and I'm going to read it for you. Okay, we will go into the first speaker. I'm going to invite Ms. Supiha Fularpunrung. Ms. Supiha, allow me to read your profile first.
Okay, thank you so much. And thank you for all of you that had a warm invitation to me. And for today is the first, may I share the screen about the presentation of head vascular.
Okay.
Sorry.
Mrs. Sofia, you have 45 minutes to present your work, your paper, so please, the time is yours.
Okay. Can you see my slide?
Yes, I can see.
Now it's already clear, right?
Yes, that was clear, Miss.
Okay, thank you so much. Okay, so first have to say good morning to everyone, and may I introduce myself? My name is Supisha Phulapbonrung. So now I am a clinical specialist of the aortic intervention of the Thermo Aortic company, and I have 5 years experience in body and neuro interventional radiologic technology at Sirit Raj Hospital in Thailand. So, and thank you, Mr. Yusrod again, and everyone for your warm invitation me today. And okay, now I'm gonna share you about my experience on the topic of head vascular imaging. So hope you will have a better understanding of the subject after this. So the objective today, I hope to impart is as follow. Number one, able to identify the blood vessel, especially the arteries in the head. From the imaging modalities you will have to work with in the future. And number two, the technique used for head vascular imaging in the radiology field. And number three, learn about the treatment procedure. So let's start with the anatomy of the major head artery first. The artery circulation, we know that the ascending aorta is the beginning portion of the largest blood vessel in your body and carries the oxygen-rich blood from your head through arch and up to the head, to the ascending, to the descending aorta down to the feet. So focus on the arch of aorta, the beginning portion. See my laser point? Oh, okay. So the first branch is the innominate artery here. And the artery arises from the arch and have the two branch. First is a right subclavian artery, the origin here of the right vertebral artery. So the second is the right common carotid artery here. Okay. And the second branch from the arch is a left common carotid artery here, arise from the arch and directly up to the brain here. And the last is the left subclavian artery, who is a right vertebral artery origin here. And the next, for the first internal carotid artery, the internal carotid artery do not supply any structure in the neck, but entering to the cranial cavity via the carotid canal. The internal carotid artery are supply the brain, the forehead and eyes here. Okay, and the next is the external carotid artery. Is after arising from the common carotid artery is up to the neck, passing through and feet of the facial artery there. And sorry. Okay, here. So this what is, you have to remember the location of the artery feeder. And the last one is the important too is vertebral arteries. The vertebral artery, okay, is a vessel that supply the brain behind or the posterior of the position like this. So all of this is a major vessel that you have to remember before you will watching the imaging of the radiology. And then one more thing that have to remember too is a circle of Willis anatomy. The two internal carotid arteries anatomose with two vertebral arteries and form to be a circle of Willis. And the circle of Willis is the artery of the head and neck branch from common carotid arteries, right and left. And the vertebral artery, right and left, pass through the transverse foramina of the cervical vertebral end. The branch multiple times and rejoin together form to be the artery cycle called the circle of Willis. So this is a more common of our field that we always see the vessel in the field. For example, the clinical significance of the circle of Willis. So the circle of Willis is the great clinical significance due to its structure, function, and the location. For example, it is one of the most common locations of the intracranial aneurysm. For an estimate, is 85% of the intracranial aneurysm is occur in the anterior circulation, such as at the internal carotid artery to posterior communicating artery function. For example, like this at the figure here. This is a preoperative of the digital subtraction demonstrate a circular aneurysm here, the big one. From the posterior communicating artery distal to the junction of internal carotid artery here. And after that, after the doctor done the procedure and do the angiogram again, the aneurysm is disappear. The second picture also says it's a preoperative of digital subtraction of the left ICA. So that show the regular, this one is an aneurysm here. And after that, after the doctor do the treatment and we do the angiogram again, the aneurysm is disappear. So the one more also important is the anatomical plane that I want to mention you again before identifying the vascular in each modality. May I remind you about first is the transverse plane or axial plane. It divides the body to the cranial and caudal or head and feet. The second one is the coronal plane to divide the front and the back. This one. And the third is the sagittal plane that divide of the left and right. So this is the picture that we always work with together in everyday axial, coronal, and sagittal, for example. Okay, for the modality and the technique, which can identify the head vessels for the diagnosis or treatment in the field of the diagnostic radiology. The first one is the CTA, the cerebral angiogram, and the time of flight technique of the MRI. So how the image present and what's the technique? Let's start learning together. Okay, for the first, start at a CT machine with the CTA brain technique. So remind what is a CT scan is a computerized topography scan combine a series of the X-ray image and taken from the different angles around your body and use the computer processing to create cross-sectional image or the slide of the bone, blood vessels, and soft tissue inside your body. And about the CTA head or brain, during doing the CT scan, the contrast medium inject into the vein and further enhance the image of the blood vessel as it circulates and by steam. And then the high resolution will dance again and it can produce the view individually or add together create a 3D image for the blood vessel in the head too. Okay, for the first, easy to identify the arteries or CTA image. see the how difference of the CTA brain non-contrast looks. For the axial plane, corridor plane, and sagittal plane, you will see only the bone and the soft tissue, but we cannot identify any the vessel inside your head. So the coronal and the sagittal. Okay. And for the next, looking at the brain in this case. So it is a different patient from the previous image, but that I show you. But I want to show you the start of the blood flow from the aortic arch of the patient who has done the TIVA procedure that I work in my field before and has come to follow up the head and neck. So the cut is not cover the top of the skull. I just tell you. And the difference with previous image, you will know the contrast medium field. Can you see? The contrast medium filling in the vessel with white color like this. After contrast medium inject into the patient vein, the vessel will enhance the image like this that you see. And so how to identify the easy way for me is, first is we find the start point of the origin of the vessel first. And then second, we follow their way, which way they go. And third is find the feeder area. And we can identify the vessel for easily. Or the another way is just remember in every cut or the three plane and what or where the vessel locate, up or down with the beside vessel, or remember about the bony landmark that near or close with the arteries. That can help you to identify and can recognize them. Okay, one technique of the CT scan is the brain 3D image that show the cerebral artery like this. Oh, sorry, that the name. So sorry again. Later hope can close the patient name. So sorry. So okay, if you remember that about the anatomy, or I give you in the picture at the first, so you will can identify all of the head vessel in your field of your work. Okay. And the next one, for head vascular on DSA modality or digital subtraction, we call the cerebral angiogram. So how the DSA work and what's the DSA? The DSA or digital subtraction angiography is provide an image of the blood vessels in the brain to detect a problem with blood flow. The procedure involves inserting a catheter. The doctor will insert the catheter into the artery through the femoral artery like that and passing it to the blood vessel in the brain. And about the cerebral angiography, is a form of the angiography which provide the image of the blood vessel in and around the brain. The image will enhance the contrast medium filling in the black color like this. And the subtraction protocol will cut out the same image before and after injecting the contrast medium again. Mean every structure will disappear and show only the vessel with contrast medium. This is for the example, the DSA image or the digital subtraction image of the right internal carotid artery or ICA. It shows the continuous image like this, and the blood arise from the arch of the aorta up to the brain. If you can see like this, here have something problem. Okay, so what you have to control is just the contrast volume, the frame rate, and the pressure. Okay, and some of the treatment after doing the diagnostic procedure for the doctor. And first is, for example, the mechanical thrombectomy, or who got a stroke fast tech will come to do this, the mechanical thrombectomy. The catheter is into the right internal carotid artery or RICA. the contrast passing up to the brain, but it's stuck. So after that, one part of the circle of Willis, you will see. So this is what the vessel means. Means all of this you have to remember in the real life, in your work field, you will see this one in every day. Next one, after remove the clot or aspiration or the RICA, the doctor will confirm that the clot is removed by doing the cerebral angiogram again. And now the blood can flow back to the brain. Okay. And one more technique is to use a different color. From the black to the white, it is known as the roadmap, or some we call landmarks. So how the roadmap technique works? When we choose the roadmap protocol and using the manual contrast medium injection, the image will enhance the white color in the real time. And however, if the position of the patient and the digital subtraction machine or the DSA machine is unchanged, you also can do the technique is use the 2D image, the 2D subtraction image of the previous or the latest image to do the roadmap technique. We call as plain marks, or some machine call smart marks. It's depending on the blend of the machine, but the principle is the same. So one more, what is the roadmap? Is the fluoroscopy. Is a radiological technique that enable the visualization of the anatomic structures using image subtraction. Okay. And one more treatment of the mechanical thrombectomy is we call stent retrieval. Mean the doctor will use the stent to pull out the clot like that. As the picture you see, one part of the vessel is lost and stuck again. So the vessel is also at the circle of Willis that I showed you before of the start presentation. Another function too of the mechanical thrombectomy too is you see now it's already come back. But we use the stent retrieval here, but the picture may be quite too small. But if you have the hair out, maybe you can see. But it will see for clearly if we do the non-subtraction together with the bone. Okay, an example of the right common carotid artery image on the angiogram. First is, so how to identify of this vessel. For me, we remind and thinking again of the anatomy. And the way to find first is is originate at the right side above the aortic arch and all up to the right side and feed the area at the right lobe in intracranial here. And then also have at the facial too. And looking down again of the tip of the catheter is at the origin of both two external and internal. So it is a right common carotid artery. Another treatment after angiogram is the interarterial chemotherapy of the retinoblastoma. So if you see of this picture, it is a chemotherapy of the retinoblastoma of this patient. And look at the view here. It is a lateral view of the internal carotid artery. And then the doctor will inject the chemo, and then the lesion will be less. And after that, after we follow up, it's like disappear like this. So what we have to do is, when we know the procedure, we will know the position to do in our work and to help the doctor to do the best of the angiogram. Next one is embolization, the aneurysm. For example, this case is by coil. the cerebral angiogram with coil embolization. After the doctor identified the lesion, he would plan the treatment and option before doing an angiogram for diagnosis. And before commencing treatment, he will find the best working position for coiling. But in this case, the patient has the left anterior communicating artery aneurysm. The right image is shown. We have to do is the angiogram again to confirm the post-treatment. The coil here, and after do the subtraction is here already gone. This is one of treatment that the doctor do. And one more for the example of the treatment. It is a carotid stenosis treatment. The angiogram seen the right common carotid artery and the stenosis at the origin of the right internal carotid artery. After doctor does the balloon expansion or the stent expansion, he will do a post-treatment angiogram. And we can see the total line of the vessel is coming again. The first one is stenosis. After doctor do the treatment, is coming again. So same. If we are the radiologic technologist or radiographer, we should know if we want to see this position for clearly, we have to do the lateral plane, the lateral side or the lateral imaging. Okay, and finally, as regard to the MRI modality, we call time of flight or TOF image. So I wish not add more the details as I am not a specialist in this field too. And I just want you to know what the procedure is about the same. And have to keep the picture of the anatomy in mind because of it's quite close to the CT like that. But the more benefit is we no need to use the contrast inject in the normal patient to see the artery or the vessel in the head. Only the patient who has the problem stenosis or can identify all the vessel in the head, the doctor will request to do the gadolinium inject like that to have the more clearly of the picture. So again, the MRI work by passing electric current through the coils wires and create the temporary magnetic field in your head. And then do the way about the radio wave and create the picture. So one technique that can identify the head vessel is time of flight or TOF. Was a dominant or non-contrast bright blood method for the imaging in the human vascular system. So the picture of the TOF image also same. So if you can remember the anatomy of the aorta of the head vessel, head and neck vessel, or also the circle of Willis, you will can identify because of it's quite feeling same. This one is more the example image of the TOF image, the circle of Willis, and the retinal view. All is quite same. This one is just flip the image and all is the same. Which one is the posterior location? Which one is the anterior location? You have to remember. So one more for the conclusion or the take-home message of all the modality, the technique on each modality. The first can identify the brain is CT, use the CTA brain technique. And for the MRI, we use the MRI TOF or time of flight. And for the digital subtraction or the DSA, we use technique for the cerebral angiogram. And this procedure can be continued for the treatment for the doctor, such as the thrombectomy, the embolization, stent expand for the stenosis treatment like that, or give the chemo treatment, the balloon occlusion test, for example, like this. So for the last.
To remember me.
Yes, just for relax. If you're feeling like lost, oh, I cannot identify the head vessel in the real life, in the real field of your work, just come back again and remind about the major head and neck vessel and also the feeder area. That just remember all this and hope today you all can get about the education together. So, do you have any questions? Also, I want to share about the experience on your country too, because of I also don't know how the difference of the Indonesia technician do for the like the intervention of the head and brain like that. Because of I'm also after I graduate, I just start at the intervention. Yes. So, Mr. Yusron, do you have any suggestion or anything to teach me?
Okay, hi Mr. Supika Labundrung.
Yeah.
Ms. Supika Labundrung is my friend that we met last year at 20 and 15 right now.
Maybe
Correct, yeah? When
but
the
for
last
long
meet,
time.
we meet in the event international competition then in Kaohsiung, Taiwan.
Yes,
Yes.
I can
And
remember.
until now, we keep our communication, and now he shared her knowledge to our students. Thank you very much, Ms. Supika Fulatundrum, for your pleasure. I think it's a big moment for our student, and I think it's a great, really, really event.
Thank you so much. Yes, and thank you to about sharing too, because of I'm also can I can remember that we have the competition at the Taiwan, right? So I think this is a like the great the great activity too that can join about the technician in other countries can share the experience. So I also don't know about the like the different protocol of the treat or any things about learning. If you think which one is different from my countries, so you can tell me too.
Okay, I think the difference is no different, yeah, with a examination in Indonesia. CT examination can doing by a CT scan or with a protocol CTA or more famous with run-off technique.
Oh,
And then
okay.
in Cycle Willis, usually we use MRI because with by using MRI is more easily for radiographer. But if any treatment for angiogram head Willis, we can use DSI. I
We-
think it's no more different between Indonesia and Thailand technique.
Okay. Thank you so much.
Thank you, Ms. Supiha.
Okay. So any question in the floor or the students?
All right, thank you for your brilliant presentation, Miss Supriha.
Thank you so
Your paper
much.
is bloody good. All right. Now we move to the question and answer session. So to all audience, if you have a question, you can raise your hand now. You can type your question in room chat and I will read it for you.
I have a question.
Please raise hand. Who will testing the question? Miss Pin.
Sinyalnya jelek. Ini nggak bisa. Okay, thank you, moderator. First of all, let me introduce myself. My name is Mafiro. I have one question. After seeing the modality DSA, it's look similar to fluoroscopy. In fluoroscopy, we have a positioning for the patient. Does the DSA modality require patient positioning? It's my question. Thank you so much.
Harder again, moderator, can you help me to recall the question again? Means about the position to do the DSA or not? To do the angiogram?
Yes, right.
Oh, okay. We just arrived. Patient just lay on in the AP view. It's just as a normal because of the plane of the angiogram that we also have the biplane. So the hospital will have the single plane, only the one tube. We can rotate for the anterior and lateral. Or some of the machine, we will have the biplane machine. That is mean fixed on the AP and fixed on the lateral side. So if for the example, the patient have some emergency or mean we cannot really just do the position on the AP view like that. So the machine can be rotated, rotate follow the patient position. So the AP view is the normal, the supine position. And then we just do like the eye and the ear for perpendicular and lay on to the true AP like that. And the machine will see. Or if another way is the machine you can rotate to see the view for the clearly. Yes. For the normal one.
Okay, thank you, Miss, for your great answer.
Thank you so much.
All right. If you have any question, you can ask raising your hand now, or you can type on this chat in Zoom meeting.
So if no more question, maybe to next to the Mr. Usual speakers.
Okay, we have one question in room chat, Ms. Sufiha. That was from Muhammad Anwar Al-Bashari from RSD Gunung Jati. The question is, can you explain about procedure of before stenting carotid intervention?
Okay, for the static carotid intervention like that. So before we come to the angio suit, the doctor will already have their plan because they have the imaging before from the CT or the other. You can hear my voice now. Okay, and then after that, the patient will first if they don't have the imaging of the DSA machine. First, our protocol is we will do the angiogram in every branch of the head vessels. The main measure is internal carotid artery, the ICA, both ECA, and vertebral artery for the diagnostic first. And then after that, we will focus on the location, for example, in the stent carotid. And then to see the location for clearly for the carotid is we know the common carotid is a branch that separate the external and internal together. So if we do on the LP view, sometimes the lesion we cannot see for clearly. So we will do the lateral plane and do the lateral image. And then the doctor will do for example, first is do with the balloon technique. That is depends on the doctor. And then if the balloon is already finished and done and going to the stent. So after do the stent, do the expand, and then we will do the final run again, like for AC. Also, we can see the before treatment and after treatment. So about the patient position, all is the same. The patient have to be the same position at the first. So at the first, if the patient lay on the AP view, have to fix like that. And also the patient have to like do the anesthesia for the don't have to move. The patient will not move. So about the position, we have to like fix. For in the Thai, we like use the tape, the glue tape and pass the patient head like that. For the patient do the anesthesia, the local anesthesia will not move anymore. But sometimes we just to make sure, sometimes it's the medicine of the NS is like something the patient can move like that is too dangerous. So for the technician in Thai, we will do like the tape at the head for fix the patient, for feeling like, okay, for make sure 100% before stenting like that. Okay, like that. So after the treatment, sometimes we like do the cone beam CT to see or to identify the stent position too. For after finish the procedure, we will do like the follow up. But anyway, how much the time is up to or depend on the doctor. It's okay about the procedure. Answer.
All right, thank you for your answer. We have one more question from Erma. And the question is, how radiology procedure stroke infarct with case on unconscious patient?
Okay, if I'm not misunderstand with the question, it means if the patient feeling unconscious and cannot do the local anesthesia, but have to do the stent the clot removal. So in Thailand, at first is okay the position. Sometimes we cannot control the patient position. Same, we use we have to tie the arm. For anyway is the position is have to be through AP, but if cannot, never mind. We use the tape or the glue at the head. For me, sometimes at the chin to the patient for not move any move before or during the doctor do the procedure to aspiration or others. But sometimes we cannot control is how to say, sometimes I the one going to like catch or how to say like touch the patient not to move like that and do the same protocol mean the view for the angiogram all is the same is we have to do the angiogram for the major vessel that I have told you the both ICA the both external and the visible, but anyway is the doctor already know the location from the CT image first. Okay, but sometimes it's just only do the CT brain non-con and come to see again. The doctor will see which lobe and then do the diagnostic for the angiogram first, and then if we already know, okay, this branch have some occlusion, and then the doctor will fix this position and do the removal. So we will move the angle of the plane, the DSA machine. But the patient that same like I'm saying. And for the post procedure in the Siriraj hospital, we have the protocol is do the CT brain non-con after finish the procedure too. Yes, do not sure it's different from the Indonesia countries or not? Mhm.
Thank you for your answer, Miss
Thank
Supika.
you.
And we have the last question. This question is from Miss Citra Nurbani. The question is complication that patients are at risk of experiencing after a DSA examination.
Okay, for the like the complication, I think is if we talking about the radiation, if on the neuro intervention, sometimes the doctor have to do like to do the treatment for a long time, sometimes like if the malformation and have to do the long procedure. Sometimes that I know is like the patient have some like the hair loss. That's one is I just asked the professor like that. Mean the patient tell him because of the machine of the blind pain is due for the long more than many hours like that. Some of the treatment that I have done is from the morning to the evening like that. So if we always use the machine and the patient some got the hair loss like that and sometimes like the skin of the red color, but it's not too dangerous like on the therapy field, but it's like have some action like that. And the another is some of the contrast allergy. Because of this one, the nurse already asked about the risks to have some the contrast medium feeling can be the allergy for the future or not, but some is don't know. Something is don't have the experience with the contrast medium, or some is the allergy with another brand, different brand, and can be allergy. So the most common about the risks that or the complication is like this. But another way is the complication after do the procedure. This one is about the treatment. That is, I think is the another way to talk. But anyway, is like have so for the mechanical thrombectomy also sometimes cannot do the 100% clot out like that. The brain infarct is coming. But that one is the another way for us like that. So for the radiology field of the technician, I think the complication from the radiology field is about this. Yes, so I hope my question is can help you.
All right, thank you so much to Miss Supiha for the great answer.
Thank you and
And
welcome.
big thanks to audience who's giving a brilliant question. Now we have something for you, Miss Supiha. It was a certificate from this event. The certificate will given by Head of Study Program Radiology on Stika Cirebon, Mr. Yusron Adi Utomo.
Thank you so much.
Okay, thank you. In this event, our study program will give a certificate for Ms. Supiha Fulabundrun for your accepting our invitation to be a speaker at international public lecture. Your expertise and contribution in this event are highly regretted, and we are honored to have you as a part of our event. Thank you so much, Ms. Supiha Fulabundrun.
Thank you so much too for all of you and the warm invitation again. So hope to see you next time.
See you next time,
Okay,
Ms.
thank
Supiha
you.
Fulabundrun.
Yeah, bye.
All right, thank you, and we will move to the next session. But for Miss Supiha, if you have another activity, you can leave this meeting first. And we all say thank you so much for your presence in this event as an awesome speaker and awesome presentation. We all say thank you so much to you, Miss Supiha. All right, we can move to Mr. Yusron Adi Utomo. Mr. Yusron Adi Utomo, allow me to read your profile first. Our second speaker is Mr. Yusron Adi Utomo, STR MKM from Indonesia. He is a head of radiology in Stikes Cirebon, and he will give us a talk about pediatric imaging. Currently, he works in more than 2 places. The first place in RSD Gunung Jati, Kota Cirebon, as a radiologic technologist of MRI, and the second, he is work in Sumberkasih Hospital as a radiologic technologist of CT, and he is also as a lecturer of radiology program on Stikes Cirebon. All right, Mr. Yusron Adi Utomo, you have 45 minutes to present your work, your paper, so please, the time is yours.
Okay, thank you for moderator, Studio Fortuna. I will share my slide. Please, moderator, can you ask your team to share my screen? Okay. Assalamualaikum warahmatullahi wabarakatuh. Good morning. I am Sandi Utomo. As a lecturer in Stikes Cirebon, I will share my experience about pediatric imaging. This event, I bring my material about pediatric imaging because radiological examination in pediatric patients now become a new concern. Apart from avoiding repetition of examination, pediatric examination also requires special skill from radiographer. So especially in understanding the nature of child. So in this, okay, next. So the principle for pediatric imaging, the principle in pediatric examination to produce appropriate image is a patient positioning. So understanding the child condition greatly influence the success of this examination. That some consider that need to be considered in pediatric imaging are the first, children is not person mature with small size. As we know, radiographers often assume that children around 5 years old are considered capable of buying directly easily. But in the fact is that not all of children have the same characteristic. So there are several special approaches to several children. And then the second, notice the mental condition and what he needs. We as a radiographer need to pay attention to the child's physiological condition and in this case, we need to give a children the opportunity to convey their complaints or pain. This is expected to increase children trust in radiographer so that children can easily carry out in positioning. And the third, another principle of pediatric imaging, his sense is very sensitive. We must remember when he's positioning the child, the radiographer should give a brief explanation in a language that is easy for a child to understand so that the child does not feel afraid in radiology positioning. In this case, we can now separate the child from parents and then don't separate from his parent, and the last, our encouragement strong for now about something. So in this case, the principle from pediatric imaging is make approach and sense interpersonal collaboration with the child and to their parents. Okay, next. Okay. In the literature, K2 textile pediatric imaging. In the literature presented by John Halbert, there are several supporting factors in the success of pediatric examination. Radiographer can design examination room using design that children like a hospital atmosphere, waiting room, examination room, then approach on their parent. This situation can arouse the child interest in the room so that the child does not feel afraid when they are in radiology room. In picture, you can model, you can design your examination room like a room child. Okay, the another principle is 2K principle pediatric imaging is immobilization. Immobilization is more important in determining the success of the examination because immobilization can increase the potential for harm the child. As we know, and we must remember, immobilization on potency give rise to danger for a patient. It's often forgotten that inappropriate immobilization technique can cause unreversible things. For example, in this case of a fracture, immobilization shall be done carefully so as not to cause the fracture to get worse. And then immobilization only used in exposure moment. It's best that immobilization is not carried out for so long. And then with immobilization, instead don't to make patient can move his body, but just minimize a body movement change. And what you need to remember is that immobilization does not mean making the patient unable to move at all, but to minimize movement so that there is no shift in position. Okay, there are some example for immobilization tools that can be used. The first, there is a stocking light can be used. Usually we use in thorax examination or abdomen examination. In Indonesian name usually famous in name with bedong. And then this is a type A mobilization. Okay. Okay, then the another key to success imaging pediatric is X-ray equipment. That X-ray equipment must be capable do exposure around 1 until 2 milliseconds, and then ability up to 125 dVp, and then need grid ratio with 8 or 10. And then for giving exposure, it's not need an instruction for arrange space breathing. Okay. And then in patient with some special needed, when we accept patient with special needed, take care and always contact with nurse. Because this done to minimize unwanted event. Patient with a special needed usually have a nurse who know more about their health condition than their families. And then take a note for drop and puncture location. Needle infunction is hematoma occurs. In patients with children using contrast media, the radiographer must ensure that the injection use can flow smoothly, so as to avoid giving too much contrast media. And then radiographer use a mask and handscoon for a sterile condition. And then there is a more important, on patient with difficulty breathe or have a history of asthma, please don't leave him alone. If relapse, please help sit down and free all of pressure and head in extend position. It must be more appreciated. Okay, then for a children aged around 6 weeks, always have a pacifier ready if they cry. If necessary, give the milk in a bottle if they crying persists. Take him out from the room so another patient can be treated. When adjusting the position, ask the parents to hold the patient body. Okay. I'm sorry. Oh. Okay, and then at age up to 3 years, immobilization devices are almost always needed for examination because assistive device make the position more precise. But attention please, children who are in an immobilization device should never be left alone in the room, except only during the exposure. Okay, normal check carried out and first at thorax examination, IP projection. In a patient aged around 4 years, is equal more better with in supine position, and both hands are raised up near the ears and tied together with stockinette. And then the pelvis and leg are supported by a compression and bench post as a sandbag. And then the head is held in place with a band aid to prevent it from rotating. And then the lateral projection, turning the patient body on one side, CR in vertical position. Immobilization method is similar to upper projection, but however, it's not possible for the patient to be an erect position. The horizontal CR modification can be carried out with the patient in a supine position. And then the PA projection for older patient, you can use the PA erect projection. And then you can be taught to regulate breathing pace, and both hands are abducted to the side of the body. And then for head examination, sorry. Okay, for head examination, we can use a preparation in a supine position. If the age is around 2 years, the body is swallowed and the head is immobilized with a compression band. Can use head clamp, use shape sponge, and can also be used because the child head is larger than his body, so the CR can be angled to the cranially. Okay, in examination examination in patient aged around 2 years, after adjusting the position, the object being examined is held with a plastic sheeter or plexiglass weight done by a sandbag. Okay, this is some special predestination with patients that have a premature. In premature patients, special attention is needed, considering that the radiographer still has to keep the child temperature warm. So the wrapping the IP in a blanket can be done during the examination. However, if the child's incubator supports radiological examination, the child does not need to live in the incubator. And then melomenincocele. Melomenincocele is a kiss protrusion in the meninges, spinal cord tissues, and field position prone during the examination. Melomenincocele should be done with the involvement of a nurse to avoid undesirable things. And then the omphalocele, hernia on umbilicus. Then epiglottitis is an inflammation of the epiglottis, so the neck should not be lift, and the signs are fever, obstruction the respiratory tract, and difficult to swallowing. And then another disease for some special pediatric imaging is osteogenesis imperfecta. There is a bone break is easily, it's better for a patient position. In this case, osteogenesis imperfecta, patient requires special attention because in this position cannot be done easily. If possible, it's advisable to manipulate the beam direction and modality rather than changing the patient position. And then the another alleged victim of violence report it to the authorities proceeded by reporting it your superior. Okay, in another process in pediatric imaging, first the front protection from accident. Not the patient shall be not be left in the room alone and see whether the existing immobilization equipment is still functional properly and safety. Report all accidents that have occurred or are about to occur so that improvement can be made at another opportunity. And another protection, there is a protection from unnecessary radiation. First, we, like as radiographer, please pay attention to CP, exposure factor, collimation, and use a filter if it's needed. And then use a gonal shield or approximately. And then the last, use the ALARA, ALADA, and ALADE principle when carrying out the examination. I think it's enough from the protecting from unnecessary radiation for pediatric imaging. And if you any question, you can call me and or find me at yusron.radiology@gmail.com, or you can call me with my number in you can see in my slide. Thank you.
All right, thank you for your enlightening presentation, Mr. Yusron. Your paper is awesome. All right, now we move to the question and answer session. So to all audience, if you have a question, you can raising your hand now, or you can type your question in room chat and I will read it for you. All right, that was enough. Thank you to Mr. Yusron for your presentation. And now we have something for you, a certificate from this event. That certificate will given by head of this event, Farhad Fadilah.
Thank you for Mr. Yusron having the opportunity to attend this seminar. We from the student association hope that in the future we can do this activity again.
Okay, thank you very much for Mr. Farhan Padilla in this appreciation. I hope this event can be make a decision which help the student to make get up for your competition. Thank you.
All right, we all say thank you so much for your presence in this event as a brilliant speaker and awesome presentation. We all say thank you so much to you, Mr. Yusron Adi Utomo. All right, I think that we have two speakers here, and we know that we're all is in the world of radiology, whether as a workers or as students. I hope our two speakers can increase our knowledge and of course can provide many benefits for all of us. So thank you very much. I appreciate it. And thank you for all the audience for being a wonderful participant. I am Restudi Fortuna as a moderator. Return back this event to Master of Ceremony, Lulu.
Okay, thank you, Restudi Fortuna, for the time. And thank you for all the material provided by our astonishing speakers. Hopefully, all of you can take the knowledge as much as possible by joining this international public lecture. I would like to extend our appreciation to each and everyone for attending this event. So I apologize if there isn't any more that are not pleasing to deliver this event. Keep happy and keep healthy for all of you. Nice to meet you and see you. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Waalaikumsalam warahmatullahi wabarakatuh.
Prosesi Senat memasuki ruangan. Hadirin dimohon untuk berdiri. Menyanyikan lagu kebangsaan Indonesia Raya. Menyanyikan lagu Mars Tikas Cirebon.
Mengheningkan cipta. Selesai. Sidang terbuka Senat Stikers Cirebon tahun akademik 2022-2023 dengan ini dibuka.
Calon wisudawan-wisudawati dimohon untuk berdiri.
Sidang terbuka Senat Stikers Cirebon ditutup.